we are facing a potential doomsday scenario with a fourth surge. Flying blind without testing is a dangerous situation. It's analogous to flying an airplane through a cloud directly into a mountain. For public health surveillance purposes, we must start testing far more broadly than we are doing it at the moment.
We are in this crisis, and the question is, what's the long-term trajectory? And of course, I mean, I don't have my crystal ball here, and it's impossible to tell, but it's very likely that what we hear of going back to normal, I think we can forget about that. First of all, it's going forward to the new normal, that we should think of it. No time to lose. I mean, we often wait too long before going into societal measures, before deploying testing and so on. We wait, for example, in many countries, they waited until mortality goes up. Now, mortality from COVID, when you see death rates going up, that means that these are people who were infected maybe a month ago or later. So you really need to act early. That's the first thing. And we've been behaving like that we would set up the fire brigade when the house is on fire. And no, you need a fire brigade all the time. You hope that they will never have to be deployed. So you have to pay people for doing nothing. I mean, to use it that way, that's how some people think it. No, we need that infrastructure, that testing.
But the most dangerous statement in the COVID era is, don't worry, I feel fine. It doesn't matter if you feel fine. You could still have a disease and transmit it to others who may not get such a mild case. And I think it's also important to recognize, and we probably will never have the data on this because of the vaccines, you know, in a good way, I suppose, is my 92-year-old mother had completely asymptomatic coronavirus. Now there's a perception it's only young people, but you know, full antibodies, test 1, test 2, test 3, because nobody believed it. So that's why we need to aggressively have screening programs. A testing protocol in a school or an office is not daunting. There's a perception that it's difficult to do, that is disruptive. There are so many technologies, from molecular handheld devices to small lateral flow devices. Putting in a testing program gives everybody confidence to go back to school, to go back to work, to go back to play. And it is not hard to do. And the costs of doing it have fallen, I would say, probably 80% since the beginning of the pandemic.
Well, PCR tests are becoming faster and faster. For example, the Visby Medical test from sample to answer is somewhat less than 30 minutes. So that is within the time limit that is required for these screening applications that I've discussed. Unfortunately, most other PCR tests are done on large instruments that reside in central laboratories. And therefore, the sample has to travel to that central laboratory, be tested often in a batch of other samples. And then the result is generated in something like 6 hours to sometimes even as long as 3 days. That's why we need to have the PCR test at the site where the sample is taken, and it has to generate a result within 30 minutes. And there are very few PCR tests that have these features other than the Visby Medical test.
Because it's critical to acknowledge that school testing and kids being in person is not just about kids, it's about the economy. And regardless of what study you look at, there are all billions of dollars a week that are missing because parents are home with their kids. And kids need to be back in schools. It's a disproportionate challenge for women, a disproportionate challenge to have kids out of work, out of school for people of color.
There is no magic bullet. I mean, understandably now vaccination is really very hot, and we won't make it without that. But that it's important to pass on the message. It's not going to be over one fine day, and we'll need to have a combination of measures which will protect us all. And we amply discussed that. That's it's all to really create back a safe society, and that's where testing is an absolute essential role.
We have a responsibility, and I include journalists in this as well as myself as a physician, to be sure that when we think about public health and addressing public health crises, that we make the resources available to everybody in the world, especially those people living in countries that have relatively small budgets to contain public health crises.